Don't be scared. I've done this before. Show me your teeth.
Hi Candace.
Hi Alyssa.
Okay, so today is your radiology rotation, and today we're going to be taking bite wings on Dexter. We'll start with Dexter and then we'll move you to a real patient. So, do you know why we have to take bite wings?
Yes, we take bite wings because we want to observe Dexter's missing teeth.
Okay, so we're not going to use bite wings to see missing teeth. We're going to mostly use bite wings to check for interproximal caries. So clinically you can't see them when you look in the mouth, but when you look at them on the radiograph, you'll be able to tell. So you're going to want to explain to your patient what's going on. You're going to want to explain the process and what we're going to be doing and why.
Mm-hmm.
And then after you've done that, you're going to come over to your patient and you're going to adjust his chair. You want to make sure he's not too low, not too high. And then you want to look at him and make sure that he's straight on. His head's not to the side or tilted down or tilted up. All right. And then before you go out and take your films, you're going to want to put this thyroid collar and lead apron on him. So do you know why we use this?
We use the lead apron because we want to protect Dexter's heart.
Okay, well actually we're going to use this to protect Dexter's thyroid and his reproductive organs and also his radiosensitive tissues. So this is going to go right around him and this will Velcro right behind. There we go. Okay, then the last thing that you want to do is you want to make sure that you check and make sure that he's not wearing any glasses, eyeglasses or chewing gum or has any removable dentures or anything like that. You're going to want to take those out.
Okay, I see.
Okay Candace, now that we have Dexter set up in his room, we're going to come out here and we're going to set up our equipment. So first we want to come to this panel right here and we're going to set the exposure factors. This panel is always set to 70 kVp and it's always set to 7 MA. Mm-hmm. That we can't change, but what we can adjust is the seconds. So for a bite wing, we always need to make sure that it's set at 0.167 seconds. All right? Then we're going to get our cassette. It's going to come in a sterile instrument packet. We're going to open this in front of the patient, and then we can assemble this. This is our RIN kit. So it comes with a ring and this little pole. We're going to slide that right on. This is the little bite stick that the patient's going to bite down on. This snaps right into place.
Mm-hmm.
Now this is my film packet. I want to make sure that this white part on the film goes to this white part. So we're going to put it right in there like that. And now we're set up. So Candace, let's go over the guidelines for the film placement now. We talked about earlier that the white goes against the white bite stick. Now also the white is going to go against his cheek. We're going to be taking horizontal bite wings today. Some take them vertically, but today we're only doing horizontal. We also want to make sure that we have the film placed behind the prescribed teeth. So we're going to take 2 bite wing shots. The first one is the premolar. So we need to get the midline of this mandibular canine and then back from there. And for the second shot, we're going to get the distal of this second premolar on the mandible and back. So I'll show you the premolar shot. We're going to ask our patient to open, place it right next to the teeth. I have the distal of the canine in this shot. You're going to ask your patient to bite down slowly. Now we're going to move the ring all the way to his cheek. I'll grab my PID. We also want to make sure that this is angled at a 10-degree angle. And also this RIN kit is helping us make sure that the radiation, the X-ray, gets straight through the contacts. And if it's angled too much this way or too much this way, then you're going to get horizontal overlap in your film. Alright, so that's how you're going to take it with the RIN kit. Now I'll show you how we're going to do it with the bite tab. So this is a disposable bite tab that you just place on the film. I place mine on the very edge so that I can line it up with the PID. I'll show you the premolar shot again. So we make sure we get the distal of that canine. You place that in there, put the tab down. ask your patient to bite. Now this is really important to make sure that you get the 10-degree angulation when you don't have the Rin kit to work with. I'm going to line up my PID right along this edge of this tab because I know that's where the end of my film is. And that looks perfect. Alright Candace, we've been working on Dexter so far, so we haven't needed to worry about our PPE, which stands for Personal Protective Equipment. But when we actually move on to real patients, we need to protect ourselves and the patient. So we need to be wearing our disposable gowns, our mask. You're going to put your mask on and you're going to pinch it over your nose. And then you're going to place your goggles over the mask. You're also going to wear your gloves. So now let's go work on Dexter and see if you can remember what I've taught you.